comes to breathing, I'd like for you to pay attention to the 3 diaphragms that are very important for the breathing purposes. One is a vocal diaphragm, thoracic or abdominal diaphragm, and pelvic diaphragm. So these 3 diaphragms are parallel to each other and stack on top of each other. So for example, if my head is too far forward, the cervical or vocal diaphragm is going to be in front of the abdominal diaphragm, so I just violated that. When I'm slouching, the abdominal diaphragm is going to be pointing downward, the pelvic diaphragm is going to be pointing upward, and my neck is too far forward, so it's not stacked on top of each other. That's a great example of what that would look like. So imagine I have a circle here, a circle around my chest bone, and a circle around my pelvis, and these circles need to be on top of each other. Just have that visual there. So you're always breathing through your nose, and that pressure from the air going through your nasal cavity and going down will apply pressure onto this vocal diaphragm, pushes it down. That fills up the lungs, and the filled up lungs will now apply pressure on the abdominal diaphragm and pushes it down. That pressure increases the inner abdominal pressure and then applies pressure to the pelvic diaphragm. So when it comes to pelvic diaphragm, imagine your pelvis being like a bowl, and you have a clear wrap or cellophane wrap or whatever you want to call it up on the top. So you have a bowl with a cover. I want you to think about when you're increasing your inner abdominal pressure, you're applying pressure over this clear wrap, and that clear sheet or diaphragm goes into the bowl, not all the way down. The bottom of the bowl is where the anus and penis are, or vagina. So you're having the bowl here, the pressure pushes the cellophane down into the bowl, and now the muscles that line inside of this bowl are the reason why the pelvic muscles will squeeze and reverse the process, so we breathe out. So in the process of breathing in, we actually relax the muscles inside the bowl, the muscles of pelvis, and in the process of breathing out, we're actually contracting those muscles to breathe out, and it reverses its process. So the pelvic diaphragm will apply pressure upward, pushes the abdominal diaphragm upward, evacuates the lungs through the nose, and there goes the next breath. So now I want to add one more thing. So we're using a lot of visual here. When it comes to thinking about breathing out, I want you to think about a jellyfish sitting outside close to your vagina or penis, whichever you've got. So you want to not death grip the jellyfish and pulling it in, but you want to pull this jellyfish inward. So think about pulling it inward through the canal into this bowl. When you think in those terms, you start contracting the muscles inside this pelvis, which is actually Kegel. So if you start breathing with that in mind, you're actually strengthening the muscles of your pelvis, which we're having a lot of issues with pelvic floor dysfunction on top of all those other things that are happening. So this is the breathing apparatus. So when it comes to you practicing it, what I'd like for you to do is always remember breathing through your nose, breathing in and breathing out. Place your hands on the sides of your rib cage. So just go ahead and do that with me. And apply inward pressure onto your rib cage. Now breathe through your nose, and as you're breathing through your nose, I want you to push these ribs outward. Push your hands outward. instead of letting your chest rise, you're letting your chest go outward. Practice that a few times. Lower your hands into the waist area where it's softer, and have a firm grip if that helps you better. Have it firm and push your hands outward. Just make sure as you're pushing out, you're not pushing down all the way to your vagina, penis, or anus. You're not doing that. So you gotta stop at that cellophane wrap, maybe a little bit into the bowl, but not all the way to the bottom. Finally, I want you to lower your hands so your thumbs are in the back portion of your lower back and the fingers are in the front portion of your pelvis. So do the same thing as you're breathing in. I want you to feel the pressure applied to both the thumbs and the fingers in the front. That's the mechanism where you're actually going to breathe in correctly, and you start building the muscles in the front, the sides, and your back, which is absolutely necessary for a proper biological breathing that all babies do. Hope this helps you.